All right, so let's talk about heat and cold. So again, here's the old school method, the old school way of looking at it. I really like looking at it this way because it makes us clinically dissect and think whenever we're talking about it now. And even in just a short time, this has been like 8 years, 8, 9 years since, you know, he put together this PowerPoint, maybe 10, depending on how long he'd been using this. But there's been a lot of change since then. Some aren't adopting that change and they're kind of stuck in their old ways, but it's good to think. It's good to critically think. So let's just talk about it. So the rundown about what we are talking about is as follows on the screen. We'll be defining what exactly it means to provide therapy, finding heat, finding cold, all that good stuff. So, and then rapid fire, we're going to go through, excuse me, and I'm going to ask you guys, would you give this person heat or cold? What would you provide for this person if they had XYZ injury? Just to have some discussion, okay? So, defining therapy. Therapy is the treatment of an illness or disability. Therapeutic intervention is the use of a known substance, modality, manual therapy, exercise that is a known result, that has a known result and is the treatment of this illness or disability. Something to note, which I think our physical therapist assistant, if you have anything to chime in on this or don't feel like I'm stepping on any toes here, physical therapy is different than a physical therapist. Providing physical therapy, I can provide physical therapy to a patient as an athletic trainer because you're defined as you're treating an illness or disability. Whereas a physical therapist is the professional that specializes in physical therapy. As an athletic trainer, behind my medical license, I provide physical therapy services. It's just a funny way of looking at the verbiage and the definition, but I digress. If you have anything to say, Amanda, please say it.
Well, that's why our titles are physical therapist assistant and not physical therapy assistant. We went over that in our first class as far as telling the difference between there's a difference in being a physical therapist because you can still give therapy and not be a physical therapist. So yes, you're
no, that's a good point. Yeah. It's so funny how there's like literally like what, 2 or 3 letters difference?
2 or 3 letters, and yes, people get
right. And it can be like a whole thing too. And some old school physical therapists, they are still staunch of like, no, you're not doing physical therapy. You might be rehabbing somebody, but you're not doing physical therapy. I'm like, definition wise, but you know, that's pulling hairs. That's just, yeah, whatever. So the matching game. Correct diagnosis with the correct intervention. Especially whenever it came to the old school way of thinking, you know, they were like very textbook. They didn't really think of things, I don't want to say that they didn't think of things critically, but they weren't thinking about what ifs or maybe other factors that might come into play. It was more of, we need to use heat and cold, which one are we going to use? They weren't really thinking, what else could we have done or what's going on? We were just thinking about the old school research with what we had. So making sure that, but still going back to that, correct intervention, you got to have it. Correct diagnosis, you really got to have that. This cracks me up, so I just leave it in here. This is him with his wife. It's a matching game. So are you doing it appropriately? Are you giving the correct intervention for the correct diagnosis? That still comes into play, even with the new school terminology and the new school thought process. You got to have the right starting point. If you're not matching those correctly, it ends in divorce. No, it ends in just not as apt of treatment or as outcome. So let's define heat. Really technical here. To make warm or hot. Yeah. According to the use of heat or a hot agent could be something like a hot bath, hot whirlpool, paraffin bath, something of that nature, just to increase the tissue temperature. Has anybody ever had fun with like a paraffin bath before? I'm sure the PTA has, right, Amanda? But they're kind of fun. Yeah. Have you? Did you guys use those in your clinic?
My grandparents had one, so we used to play with it all the time.
Nice. Yes, it's so much fun. It's kind of like whenever how you used to play with like glue, right? And then you peel off the glue. Same exact thing. It's just wax. It's another way, especially with OTs. Future OT in here, you'll probably see this, especially if you're dealing with the feet and hands. And
I think that they have these at nail salons on your feet.
Yes, you're exactly right. And again, doesn't it feel good? Like it feels soothing. So kind of goes, which we'll talk about here in a second, is it that physiological feeling or is it the psychological feeling? Because it feels good. All right. So the physiological effects of heat. Increase the localized tissue temperature. So we're talking about we're bringing blood flow in, we're increasing collagen extensibility, muscle flexibility, metabolic rate, stimulates the pain control words are hard, pain control gating mechanism. So basically what that means is, we're trying to increase the blood flow to an area. So you think about if you're treating a low back patient, maybe they came in and you're like, okay, go and lay down on a table, I'll throw a heat pack on it. I did this in my physical therapy clinic just because of time. If I am being honest, I would put a heat pack on them because usually they wanted that feel-good fix right away. If I didn't give them that feel-good fix, sometimes they would just completely shut off. So sometimes, again, you have to play to that psychological aspect as well. But it also it's a soothing feeling. Something about it that just relaxes, calms, and it stimulates that pain control mechanism just because it's mitigating that pain and helping you out there. Now, whether slapping a heat pack on is more effective to warm up the site in the body rather than a bike or doing some squats or something else, that's almost a moot point nowadays. Everybody knows that heat produced by a heat pack on your low back is not going to get you the same effects as me throwing you on the bike for 3 minutes, 5 minutes. Just not going to work the same. So, therapy uses goes back to the matching game. Which diagnosis would be best for heat? Are we thinking acute ankle sprain or acute AC sprain? Indigestion, concussion, or hamstring tightness? Do any of these kind of strike you that they would need to increase muscular flexibility that we could use to help with that?
Hamstring tightness.
Hamstring tightness.
Yeah, right, because like it's gnawed up like this, which why was it there in the first place, and so many other questions I could probably ask, chicken or the egg, but it would feel good, correct? It'd bring that blood flow in. It'd be that pain control. It'd be that stimulus to relax. Good point. Any of those other ones that I thought that the indigestion one was kind of fun. Probably not for acute, right? We can discuss that here in a second. So which diagnosis would heat be best for? Day 1, day 2, or day 3 after an ankle sprain? Recall that it increases the blood vessel diameter and increases local metabolic rate.
Day 3.
Day 3.
Right. Exactly right. So we don't want to apply heat too soon, which again kind of goes back to the old school way of thinking, but we'll get to that. But you still don't, it still does make sense almost to the mind, like to common sense, that we wouldn't really want to increase the blood flow to an area that's being pumped full of swelling and all that stuff at the very beginning. We kind of want to mitigate that. But again, we'll get into that here in a second. How, well, do we not? It's a fun discussion, but let's get through this and then we'll go for a fun rant. Now, let's define cold. So, bodily sensation produced by the black feet. So basically, we just took it away. This might be a cold pack. This might be a cold whirlwind. Oh, whirlwind. Whirlpool. Game ready. That's a great thing that a lot of people love. It basically, it's a boot or a component that you put even on a shoulder, waist, low back, where it kind of gives a little bit of compression as well as that swirling cool water to provide that cooling factor for you. And again, it'll decrease that tissue temperature and bring about the physiological response that you're looking for. Just gonna walk this because I just heard my son. The physiological effects of cold. So it decreases tissue temperature, localized. So that's key there, localized, which in turn decreases that collagen sensibility, the muscular flexibility, blood vessel diameter, local metabolic rates, and stimulates again the pain control gating mechanism. So you still get that pain control sensation, right? Because everybody's probably put ice on something that hurt, right? And it's like suddenly you don't feel it anymore because everything's numb. Now, was that a good thing? Because basically you're telling your pain mechanism or your pain feedback that, shh, you know, like, hold on. It's a good thing, right? To an extent where we kind of have to, you know, let our body just chill out for a second, put a stop on that pain. However, as we'll talk about here in a second, are we mitigating anything else by applying that heat or that cold? So thinking about that cold decreases blood vessel diameter and stimulates the pain control gating mechanism. Which one would it be best for use? Quadricep soreness, nosebleed, athlete's foot, or bicep tightness?
Nosebleed.
Good point on the nosebleed. I could see how you could want that, just because it would help to promote that blood clotting. Fun fact, if you stomp your heel, usually that stops the nosebleed. It's like this magical, creepy thing that you can do to stop nosebleeds. I've used it myself, and it's creepy every time it works. But
Is that to draw blood away from your nose?
What?
Is that to draw blood away from your nose, maybe?
Truthfully, I don't know. And I've searched it, and I don't know that there's been a study that even like says, if you find one, please send it to me, because I would love to know. But it's creepy. Actually, I was told this by another athletic trainer. They were like, yeah, if you ever have a kid with severe nosebleeds, have them stomp their foot, maybe once, maybe twice, and you'll be amazed at what happens. And I was like, okay, yeah, sure. It works. And it's kind of creepy how it works, because it was like a sudden stop of their nosebleed. However, quadricep soreness the day after a workout game, that would probably help, because it helped to, you know, reduce that swelling, help to decrease that blood vessel diameter, and help with the soreness after a workout. But yeah, the nosebleed, I could see how I could see where you could get that as well. But yeah, just try the heel hit. Let me know if it works. You'll be freaked out just like I was. So let's talk about a diagnosis that it would be best for versus the patellar tendonitis. Asthma attack, precursor to stretching, precursor to massage. Which one?
Patellar tendonitis.
And in my mind, I would argue that you shouldn't use it for that. But yes, you're correct. Out of these, it would be. Because it doesn't make sense to ice something before you stretch it or massage it, right? You're like literally doing the opposite of what you need to do. Asthma attack, why would you do that? But then the patellar tendonitis, the pain and the inflammation process aspect of that is kind of what they park their best behind that one on. And I used to think that too, because it would really help to mitigate that pain and stop that inflammation. So before we go on rapid fire, I'm going to ask you guys some questions as well. So let's go back to this. We have that patellar tendonitis. Yes, that's it. What does itis mean? Does anybody know what that means, itis?
It has something to do with chronic.
Inflammation.
Inflammation.
Yeah. Nicely done. So you're right. It is chronic. It usually is chronic. Good points on that. But is a inflammation. So patellar, so you're having some knee tendonitis, so the kneecap, probably on the base, usually right there at the attachment. And the gold standard before, the thought process was, okay, so we have that inflammation response, we need to ice it to like bring back that inflammation response. Now we're starting to see where they're saying, why would we do that? We maybe need to coax that inflammation response in the correct way, whether we need to do some soft tissue work directly on that tendon, so maybe with some tools, so instrument assisted soft tissue mobilization to bring and direct that inflammation and that blood flow into the correct areas. A lot of people, they'll maybe ice after that just for the feel goods. I call it the feel goods. It's not to degrade it at all, but ice and heat usually are kind of the feel goods, right? Does it cause a significant or substantial benefit or change to the tissue though? What are we looking to do long term? We need to start asking ourselves these questions, and a lot of smart people, smarter than I am, are asking these questions. And there's even the whole new thing that I'm going into right now, I think, is the cold theory on whether we're supposed to use it acutely, which is an unpopular opinion, right? Like, especially as athletic trainers, we're like, okay, slap some ice on it. But the stimulation of that inflammatory response is good. So we don't want to mitigate it too much. Now, you can always have too much of a good thing, right? So maybe it does have that time and place. But there are also other methods of stimulating that inflammation or getting rid of that inflammation that we could use without shocking the system or the tissues there around that joint. It's kind of the chicken or the egg, and everybody has their own opinions. Same with heat. Just because I slap an ice pack or a heat pack on you, did I really do anything therapeutic to that location besides feel goods? Did I really enhance your healing process besides buy me 5 minutes so that I can get my paperwork done? It's challenging all these different things, and I don't think it's going to change for a while, because as somebody who's in that setting, you have so many different patients. You're like thankful for the heat pack. You're thankful for the ability to ice. Because
are you saying like those are just something that we should ask ourselves, or that ice isn't always a therapeutic? Because I was taught that ice decreases inflammation.
You're exactly right. And I even said that yes, it does. But we also want an inflammation response or healing. There is power in inflammation. There's a reason why our body does stimulate that inflammation after injury. So, and this is just current, and I'd encourage you guys to read some new research, and I'll send you some that I've been looking at myself on should we be using ice all the time. Maybe there's a time and a place for it. I still use it on sometimes. I'm not saying that you shouldn't all the time. However, it is good to start testing our thought processes. Why are we doing that? Are we just doing it because somebody else did it? Because the person who taught us said, oh yeah, we've done this for ages. We always slap some ice on there. Just ice pack after the game, no worries. Or are we just doing that to slap a Band-Aid on something and not fixing the problem? So it's more of you as a practitioner later on, especially you, Desmond, as you're going into your practice, critically thinking on, okay, what am I really doing? Does this person need that psychological help as far as that heat pack? To maybe that's his way of deregulating or turning down that nervous system or turning on that parasympathetic nervous system. Or is this a way to relax him or her before we get started? Or maybe somebody's in so much pain that we need to slap some ice on there because they are freaking out and they need that mitigation. Or do we need to kind of hold off on that? Maybe only have them put ice a couple times a day, once a day, versus having them on and off every 30 minutes, 15 minutes. Again, I call to you guys to ask yourselves, and as you go through your profession and as you go through your academic careers, to start looking at the new research that is coming out and take note of it, because I don't think any of us here want to get stuck in the, oh, I do this because XYZ told me so. We are in an age where we need to have that backing of, okay, we're in an age of, we do have that research now. We do have those critical thinking skills, and we're not just going off of, what the textbook said. We're also critically thinking and gathering data And we're looking at the different scenarios instead of being like, okay, this person fits in this box. I'm going to do this, this, and this, and this because this is what I've always done. Or because this is what every person who had this, that's what we do for them. We need to start taking a step back and critically think. Okay?
I see what you're saying. And a good example for that, what I did my journal on, I don't know if you got a chance to look at it yet. It was about open chain kinetic exercises. And I didn't know that people just feared them because they were just taught not to like them. But from the research that I read, it was more beneficial to do them.
And so open chain versus closed chain kinetic exercises, basically, you know, how much support are they being given, or I like how you said whether they were taught to fear them or not. That's an interesting point. It goes to show that there's a power in the suggestiveness of like, okay, don't worry about your ankle sprain, because this is going to be a acute ankle sprain is our first rapid fire one. So don't overthink it, but critically think about it. Let's just go into that. Let me just, yeah. So acute ankle sprain, let's talk about that. Okay, so Susie sprained her ankle on the soccer field. Happens all the time, been there, done that. They're like, okay, don't worry about it. Let's wrap it up with some ice. Make sure that you elevate it. You know, rice is the thing that they say. They did say. It's kind of going away now. Rest it, ice it, compress it, and elevate it, right? And then we go on. Now they're seeing the impact that stinking stupid ankle sprain has on their performance later on in their profession, as well as throughout their body. And so it kind of begs to differ. Okay, are we basically, is it kind of like the helmet in concussions where we're basically slapping on a Band-Aid of sorts and being like, oh yeah, just take a couple days off, or, you know, elevate, stretch, ice, you'll be great? Or are we doing something that's actually beneficial for the body long term? Again, thinking back to, okay, are we icing all the time because it hurts and we want to be stubborn and we want to do a lot of things, so then we just ice it constantly? Or are we icing it a couple times, but then we wean off that ice super quick so that we can get on to the good stuff, where we're doing active range of motion, where we're getting that strength built back up, where we're working on our foot mechanics, where we're working on our glute mechanics, our core mechanics. There's a lot more that needs to happen than you parking your butt on a couch and icing it every time that it hurts. And that's usually where we get acute ankle sprains that turn into chronic ankle sprains, because people are like, oh, it's just an ankle sprain, I'll ice it, it'll be fine. I have so many kids like that, and actually women that I'm working with right now, return to run programs, where she didn't think about like, okay, it was a substantial ankle sprain, and now a few months later, we're still having to deal with it. So again, just things to think about. What are your thoughts, guys? Anything?
My daughter actually sprained both of her ankles at the same time and was non-weight bearing. She was in a wheelchair.
Okay.
One of them was a Lis Franck sprain, and the other one was just yeah. And we did the whole park your butt on the couch and ice it. And it wasn't until she started looking up therapy exercises that she actually, I mean, you know, after 3 months of sitting on the couch, once she was weight.
Oh, if just in case, like, I'm sure Amanda can speak to this, but Lis Franck injuries, they suck. Like, there's no elegant way to get around that. They suck.
They actually missed the Lis Franck. So we had to go, you know, we ended up at 3 different doctors and the specialist, you know,
or anything like that they're going to do. No.
Well, it was a few years ago. She's actually a dancer. She was warming up backstage to go into a performance, did it backstage. So they had to reblock the dance very quickly, and it was a big deal. But she's doing, you know, much better now. A few years down the line, she's 23 now. So
okay. So yeah. First of all, those suck. They're at the top of your arch, and they're just pain, because if you think about where all your drive comes from, your weight bearing, like it's a terrible injury to have, and especially in football, that's almost a career earner right there. And especially for dancers, because does she go on point at all, or is it a different type of dance?
She was not on when she did it, and
Okay.
it ended her point career.
I was about to say, yeah, because and that's my son. Sorry if you can hear him. He's screaming at the top of his lungs. But if you do have that injury, it changes everything. Think about the biomechanics behind that. But besides my son screaming in the background, the ankle sprain, especially bilateral, yeah, you're parking your butt on the couch because you don't want to move, right? And you might be wheelchair bound. But even then, I would argue that we need to be proactive in getting her moving, getting those things moving, even though they're not weight bearing, getting exercises, because that will do so much more to produce the healing and bring in the nutrients that we need, rather than just slapping an ice pack on there.
Yeah, it wasn't until she started doing the research on her own and finding, some exercises that she could do. It wasn't until she kind of took things into her own hands that she really started progressing. Once she was no longer, I mean, this was weeks.
And that's so sad. Like, I hate that for her, because there's a lot that can be said for getting proactive and kind of getting a little bit ahead of that and getting that, because that'll stimulate the collagen, that'll stimulate the muscles, that'll stimulate blood flow so much more than everything else. And dimming that and depressing that with ice, for the first couple days, like, oh yeah, because you're in a lot of pain and I do not want her to suffer. Please ice it. But then also supplement that with heat maybe, or movement, just to get something else in there. But interesting. Well, thanks for sharing that, Misty.
It does make a lot of sense. I mean, since blood is a connective tissue, one, and then after years of playing baseball, especially after pitching, our coach would make us run around the diamond, and that was to run the soreness out. Even run the day afterwards, and I mean that makes sense to get that circulation into your sore areas for the the healing effect.
I like that approach better than the coaches who say, okay, now go ice your shoulder. I approve of that message. Just because, okay, you threw like 1,000 pitches, now go ice it, because that's going to undo all that damage. I like that approach where, yeah, you stimulate that blood flow, you get the healing nutrients back in there. Because if you think about it, if we stunted that inflammation or that blood response, are we getting that fresh new blood, that healing tissue, those minerals, those juiciness? Like, no, you're not. You just kind of cut it off. So, no, good points. All right, let's go on to the next one. So, bruise. So, contusion. Like, you whacked your shin on something in the middle of the night. Now that sucker's about that big. And it's nice and pretty in multiple colors. Do you ice it? Do you heat it? What should you do to it?
Ice it.
Immediately afterwards, I ice it, and it constricts the blood vessels, so blood stops coming and pooling in the area.
Yes, exactly. And so that would, who was that? I'm so sorry.
Amanda,
I thought so. But exactly. So you're going to want to stump that blood flow, because think about what a bruise is, right? What is a bruise, for those of you who might know?
it's blood pulled up under the surface.
Yes. So basically, do you want to add more blood flow to that, where it's like just pulling and pulling and pulling and pulling and pulling? No. However, you want to give it a little bit of ice or coolant or something of that nature to help get all that old blood out of there, right? So it's kind of a twofold thing. You want to stop that old blood or that new blood from coming in for a little bit so that it's not just continually pulsing. But you also want to get those tissues moving, right? Because now you have stagnant blood in there. So as the body starts to reabsorb that and take it away with all its beautiful cells that mitigate and run in there to help, you also want to have that rest period in between the ice so that it can do that, right? So again, like she said, immediately you're going to slap some ice in there. So it's going to feel better, but also it's going to stunt that. And then you start, again, getting those tissues moving. So if you're seeing a pattern here, there's like a time and a place for stuff, and we can use and abuse something for a little bit too long, heat or ice, that has effects. All right, so let's talk about hamstrings. Hamstring strains. These are the ones where usually you have like a track star or football player that they're sprinting down the football field and then suddenly they grab their hamstring and they like go down like they've just been shot. They're not fun. They're really not. And they take a while to come back from, especially if you're stubborn and you go past it. But let's say 4 days post-injury. We're past that 1 to 2 day mark. So what are we thinking? What should we do with it?
Heat.
Heat. Now, what type of heat? Are we going to be passively doing stuff? With it?
Yeah, I would passive.
What?
I would do passive heat and work it out.
Yeah, work it out. I could see that that thought process. Yes, to an extent. I would almost argue you
With only like lightweight, maybe banded, you know, just to get the blood in there.
So again, this is all to a therapist's discretion or a professional's discretion because everybody has their own opinion, which is a beautiful thing. However, I would do some passive heat to bring some relaxation, especially because a lot of times it's painful and they don't want to move it. So it's almost about that psychological piece too. And then I would get it moving. We're not going to stretch it to the max. We're not going to strengthen it to the max. However, we are going to make them walk around. We're going to make them do things to where that full system body heat is produced as well. Just like as you did after you throwed and or you pitched, throwed after you were pitching in baseball, he would have you go run around. Same thing here. You're going to want to still stimulate the blood flow that transaction throughout the body, not just locally, to get that back in, because then you want to start working on, okay, compensation patterns. How has the strain for the past couple of days affected how they're walking? And you can take into account that. Nip it in the butt is kind of what I think, because there is going to be compensation. So if you start noticing that now, still get them moving. Now you're not going to have the max deadlift. We're not going to go crazy. We're not going to have them on the black bands doing hamstring curls. We're not going to have them doing, you know, a 400-meter sprint. We're not going to be having them touch their toes and try to force a stretch. But we are going to get some gentle movements in there. The heat is going to help relax, and then back that up with some therapeutic exercise. Good job, Mark. So, plantar fasciitis. This guy is a chronic injury. It's literally the biggest pain in your foot whenever you wake up in the morning if you have it. Would you want to ice that or heat that if those were our 2 options?
Add heat to it.
Mm-hmm. Which makes sense. Which makes sense because you're trying to stretch it out, right? You would think, okay, I need to increase some blood flow to there to get stuff moving, right? So I see what you're saying there.
I was going to say.
But it's an itis, right?
Yeah. So then, but then you also have to look at it in itis at the end of that plantar fascia, itis, inflammation. So you want to help with that inflammation response. So sometimes maybe heat isn't optimal, which again gets us thinking. That's what's so hard about this subject, because you could come at it from about 14 different angles, and one of them's probably right, probably 5 of them are right, maybe 10 of them are right. The school of thought that is right now, so whenever you wake up in the morning, you should massage out your foot, maybe roll it on a frozen water bottle or something cold. That way you're helping to with that inflammation response. However, I've also had patients that awesomely responded to massaging their foot every morning with a yoga tune-up ball or massage ball, massaging their calves with a yoga tune-up or massage ball, massaging their hamstrings, and then I have them stretch and move and do different exercises. And that's what helped whenever the ice bottle wasn't really doing the trick. So again, it goes back to that thing where not everybody's going to be a cookie cutter scenario. Maybe we try the bottle and it's just like, no, it pisses it off that much more throughout the day. Then okay, we got to try something else. It's the weird, amazing thing about the human body is that every person is different. So no, I like that because you guys are both right. You want to be able to get that cooling factor, stunt that inflammation. But then you also want to get the extensibility in the tissues. And I would almost argue that that needs to happen up the chain in the hips and the hamstrings, calf, core. That's probably where that needs to happen. but that's a conversation for another day. Any muscular soreness or tightness directly after an activity, what should you use?
Ice. And I say that because like I was taught that soreness, you would ice that because of the muscle being too tight and gripped together, but fatigue, you would relax it with warm.
Yeah. Anybody else have an opinion?
I would think heat just like
I'm sorry, say that again.
I would think heat like a
I can't hear you. Sorry, it might just be me. I can't hear you.
I can't hear her either.
Okay. If you need to type it out, Miss James, go for it. Anybody else, though? Thoughts, concerns?
Can you hear me now? Sorry.
Yes, I can.
Okay, I was saying I would think heat because almost like a cool down workout, just to keep that stretch going and not let it tighten too much.
Okay.
I'd say movement. Like anytime I'm sore, like the thing that works my soreness out is movement.
Mm-hmm.
I was thinking heat too, because like when you're sore, you stretch your muscles to like let out that lactic acid. So heat would like loosen up those muscles regardless.
Okay. Good point, Miss Clark. Anybody else?
Would you ice it directly after activity to give it a break and then heat it later on and go vice versa? So it kind of, it's like its healing process. So like if you heated it directly after activity, couldn't you like pull it more, I don't know, maybe making your injury worse or the soreness further? Does that make sense?
That makes sense to me because you know how like athletes will do like the ice baths?
Yeah, definitely. Oh goodness, yeah.
So now you can kind of see how this conversation can go like 14 different ways, right? Because you're all thinking critically, and I love it. But now we have to kind of back it up and be like, okay, so we have muscle soreness or tightness directly after activity. So we're definitely fatigued, we're sore, we're tight. Now, we've all seen the ice whirlpools or the ice tub baths, right? And they do have a purpose where you get in there and you like can't feel your face or anything else, and then you can't breathe on top of that, and you're just like, oh, this sucks, right? And your coach is sitting there laughing at you or something like that. It has a good purpose because what it's doing is think about what does ice do? It helps to constrict, it helps to stunt or decrease that blood flow, decrease extensibility, decrease all these different things that you're having. Plus, you get that nice little pain control of, okay, I can't feel anything anyways, right? Because everything's numb and cold. On the flip side of that, the heat camp, you're thinking, okay, I'm already tight. Why would I want to add ice to something that's already tight and make it more tight? That doesn't make sense either. Because then once I add ice to it, like, then I can't even move it even more. So why wouldn't I add heat to it to where I could stretch more? Good point there. Think about saunas. There's a lot of people who go into saunas after workouts for this relaxation, right? Also heat acclimatization and so much more for metabolic and brain health and yada, yada, yada. But that's also a camp too. And then I love the answer of movement. It makes me happy. You're totally right. Because now we're after activity. So say we played a soccer game. If we sit our butt on the couch, aren't we just going to get that much more tight? And that, which we've all done this, right? Like after leg day, we were so exhausted that we parked ourselves on the couch and we regretted it like 10, 30 minutes later, and we waddled to the kitchen to get something to eat or water, right? So getting that light movement. So really, all of the above are right. It's one of those things where I can't say that, Miss James, whenever you work out and you do a heavy powerlifting session, CrossFit session, whatever floats your boat, you should do this thing after you work out, and that will make you feel like $1,000 and bam, you are at the top of your game. Same way, Miss Perry, if you decided to go run a marathon and you came back and I'm like, girl, you better not sit down, you better start walking, you better stretch, you better do this and that, you're probably going to look at me like I'm a crazy person. You're like, my butt needs to hit the pavement right now, I'm about to collapse. I just ran a bunch of miles. So again, it kind of varies, which I hate to say that. But these are conversations that you have to have with your athletes, with your patients. And how are you going to articulate your thoughts? Because you're all coming at it from good points of view. Let's think about this way. So what if we got into a whirlpool right after our activity? We just kind of shut everything down, it kind of clamps up, da-da-da-da. And then we step out, we kind of let ourselves cool off. Maybe we go for a walk, a slight walk. And then later on in the day, we decide to stretch. We decide to maybe get in the sauna, something like that. Or we do the flip. After our intense workout, we go hop into the sauna and we're like, oh, this feels amazing. Those people who love cold weather, they're probably like, you're crazy. But for those of us who like the heat, we're like, oh, this feels great, right? Same rules apply. It could feel great and then we stretch. And then later on, we're like, you know, I need a little bit of coolness. So I'm going to add an ice pack to my knees because they're sore. And it helps with that pain response or that tension or that soreness. Does chicken or the egg conversation come into play again? Yes. And it'll vary from person to person. Some people, whenever they get into an ice bath, whirlpool bath, their body responds like, oh, hell no. You did not just do that to me. And it almost like puts it into a shock state. Whereas some people, they get in there and they feel like $1,000,000 whenever they get out, right? So I know that that doesn't really give you a definite answer. However, it does make you think. And then we didn't even talk about anything like foam rolling or soft tissue work or anything like that that might help with decreasing that tightness, stimulating blood flow, helping with soreness. Thoughts? Hey, great question. So if movement is the best for me to get the soreness away, then when would be the best time to actually sit and relax? Great question. So usually after, say, you've done an intense workout, or say you've gone, I have a runner that I'm training and I had her do 400 repeats. At the end of that, we're definitely going to be stretching calves. We're definitely going to be foam rolling our feet. We're definitely going to be maybe doing a few glute bridges before and after, just to make sure that those glutes are nice and supportive and active, and diaphragmatic breathing and all this sorts of fun stuff. But you still have to recover, correct? Because the magic happens in rest. We can do all the fun stuff, whether it is icing, heating, whatever biohack we want to do, but the magic does happen in the rest. So movement is best, yes, always moving. Moving is great, but you do have to rest. And so whether that means, you know, after you get done with your workout, you go chill out for 30 to 45 minutes after you've cooled down, great. It's really going to be variable person to person, because how I recover is going to be way different than Misty, Miss James, Perry. I mean, like, you guys, it's going to be variable for each person. However, there are common factors that we see throughout where people respond well to that ice stimulus, where it decreases that pain sensation. People respond well to stretching, to movement, to light, gentle movement. People respond well to that heat placed on the lower back after an intense workout or before a workout. I know that that does not give you a concrete answer, but it's not supposed to. It's supposed to get you to think, and that's the scary part, right? I wish I had all the answers. However, I'm going to be sending you guys some articles just to stimulate those thoughts as well. And maybe a couple of YouTube videos, just because I have a couple of athletic training friends that are way more intelligent than I am, and they've been diving into this a lot. So, what other questions do you have? Let's go for another one. Medial tibial stress syndrome. What is this? Anybody? layman's terms name. What is this?
Something to do with the wrist, maybe?
Who?
Is it shin splints?
Uh-huh.
Forearm stress pain.
I'm sorry?
Like forearm stress.
Nope. Because look at what it is. Do you have a tibia in your forearm? Nope. It's in your lower leg. Close. But it is shin splints. So for shin splints, say we have a cross-country runner, because that's where my experience is with these guys, or basketball player. Love it. Basketball player, where they've gone to the court and they've been playing, and lo and behold, they have buttloads of shin splints. What should we do for those bad boys? Ice or heat?
I ran track in high school, and they would always ice them.
Mm-hmm.
2 huge ice bags and wrap it around, and they would lie down, and they'd lay down with them on.
I remember the same thing.
Yeah.
And that's a good point. Like, we did it too, especially whenever I was at Union. It'd be so funny because you could tell whenever all the cross-country runners were done or basketball players were done, because there would be like a buttload of guys and gals waddling out with ice bags wrapped around their lower legs. Because what are we trying to do? We're trying to decrease that inflammation, correct? Because what it is you have pissed off attachments from your bone to the muscle. So that nice little junction right there is just hacked off. And I could go on a rant about how they need to have corrective exercise and better glute muscles, but that doesn't really matter right now. We're just trying to mitigate pain, mitigate the inflammation. So yeah, that's the response, is to wrap some ice. Heat, not so much, because I mean, you've been doing a lot of stuff. I mean, it might help to relax. But of course, again, going back to that critical thinking piece, are we just slapping a Band-Aid on something and sending them out the door? Are they doing any sort of corrective exercise to prevent the shin splints? Because yes, you can prevent shin splints, y'all. It doesn't have to happen. You don't have to suffer. Are we helping them recover appropriately after? Are they wearing the correct shoes? Are they, there's so many other things that could be going on. Are their calves tight? Are their feet tight? Are there, what's going on? Is their quads tight? What's overcompensating? Why is that muscle having to work so hard? What's going on? Or are we just slapping some ice on there and then moving about our day? Any other thoughts on that one? Okay, let's talk about stingers. Has anybody ever heard of a stinger in football? Basically where you get checked and then it you sting, like there's like a bunch of shooting sting up the brachial plexus. So the brachial plexus is up in here, right? It's a massive plexus of beautiful stuff going on. You'll learn it in anatomy. It's so much fun. It's a beast to memorize. But whenever you get hit, say, this is definitely seen in football, a lot of times, I'm going to answer this one, you'll wrap it up with some ice.